Joining us now is Callie Means. Callie, great to see you.
Great to see you, Charlie.
Straight off
from D.C.
You and I both were there. I was in the White House yesterday. You were actually with Bobby Kennedy for his 2 hearings. Also, you're the co-author of Good Energy. Everyone should check it out. Callie, give us a status report from the front lines on Bobby.
Let's take the Dems off the table. I mean, Elizabeth Warren and Bernie Sanders are 2 of the largest recipients of pharma dollars, total shills. They were talking about baby onesies. They were acting like they cared about children's health, but they didn't say the words diabetes, obesities, or heart disease, the things that are really the scourge of childhood health right now. They didn't say those words one time in the hearing. So let's take them off the table. The bottom line, Charlie, is we've got to get the Republicans on board. And Bill Cassidy, to his credit, was direct at the end of the last hearing, and he said he's still on the fence. I think your tweet, Charlie, was pitch perfect. I think we need to take Senator Cassidy at his word that he, as a doctor, he does care about public health. And I think he's talking a bit past each other with Bobby Kennedy. He says his vote's contingent on knowing that Bobby Kennedy is going to maintain trust in science. The truth, as we know as parents, we're not scared for our children's health because of Bobby Kennedy. We are scared because the American Academy of Pediatrics is pushing processed food on our kids. We're scared because they're pushing Ozempic and other drugs on our kids as the standard of care. We're scared because still the CDC is saying a 6-month-old should get a COVID-19 shot. The public health authorities are responsible for the breakdown of public health. And you know this and I know this. I know you've been very close to Bobby throughout this process. He is hell-bent. His life's mission with President Trump is to restore trust in science. You've seen these meetings. I'm shocked. It would shock anyone. I'm not shocked. But behind closed doors, it's not about an ideology. It's truly about getting the NIH money to the best researchers. Yeah, that's what they want to do.
So let me just ask: is there going to be some follow-up privately with Cassidy and Bobby? I imagine they can meet as much as they want. I mean, what happens publicly is somewhat performative.
I want to talk to the Maha moms because, as we both know, Bobby Kennedy, more than maybe any other cabinet secretary, came in there with a great coalition.
Like a legion.
I mean, it's an incredible coalition. You saw it visually at the hearings. I mean, thousands of Maha moms packing the halls. So I want to be really clear to everyone watching because I know everyone's really fired up, and I think we understand the societal stakes of this nomination. Let's talk to Senator Cassidy with respect, as you did. I think we need to bring him along. The Maha is a new movement that health is not about the intricacies of Medicare, Medicaid policy. It's about really getting to the root cause of why we're getting sick. And I think Senator Cassidy can be brought along on that. Private conversations, of course those are happening. Of course those are happening. I think he's an independent guy. He's obviously made some decisions we disagree with in the past. But
like voting to convict the president, but
some big ones.
This could go a long way in his redemption arc.
There's some really obviously water on the bridge going backwards. Looking forwards, this is what I'd say to him. And honestly, Charlie, I think it's probably what's being said behind closed doors is that he's concerned with public trust in science. And Bobby Kennedy and President Trump, it's promises made, promises kept. And they had 2 promises in this campaign. It's to return to gold star research. And it was really a positive health future where 95% today of healthcare costs are managing chronic disease. We could have an incentive system where companies are incentivized to reverse disease, to promote longevity. I know me and you read a lot of health blogs and books. We can put that into medicine and incentivize and reward companies. Right now, we have a crony capitalist system that profits when we're sick. So there's this positive vision forward that I think they're telling Cassidy behind closed doors. I'll say this, Charlie, and I believe this with all my heart. I believe a yes vote from Senator Cassidy and every Republican senator, I believe they will consider it one of the greatest votes of their career. In 4 years at the end of the Trump administration, I'm not joking about this. I think President Trump will be winning the Nobel Prize. I think science is we're so lost right now. We know the predetermined outcome before we do this study. We are going to get back to asking tough questions. And President Trump, he said it again and again, we're going to figure out why the hell our kids are so sick. And we're going to steer research to that. That's what's going to happen.
I want to play a piece of tape here in a second, but just really quick, can you riff how sick our kids actually are? Grandparents sometimes don't realize or recognize, kids get sick all the time. No, they are chronically, not acutely ill.
I mean, every parent watching, you and me, that's what got me into this, along with my mom's death. I am scared about the future our kids are walking into. 1 in 30 kids in California having autism? That's really, really scary. I'm frankly, to be honest, concerned about the pharmaceutical projects. I'm concerned about the pharmaceutical products that are shoved down kids' throats. 40% of teens are on a pharmaceutical right now. We have 50% of teens overweight or obese, and it's 3% in Japan. The Biden administration held this number until after the election, but according to recent reports, 38% of teens are pre-diabetic. We have a devastation among children's health. President Trump held up this graph on the Joe Rogan podcast. It showed we are spending 3 times more per capita than Europe, which, by the way, has terrible healthcare policy on health, and living 10 years less than our friends in Switzerland or Japan, and 7 years less than the Italians. There's something really broken about our health incentives. And Bobby Kennedy said it, Charlie. There's nothing more profitable than a sick child. The insurance industry, pharma industry, and hospitals make money when a child is sick with a chronic disease for a longer period of time, and they lose money when a child's healthy. That's the fundamental problem.
I mean, it begs the question, then they want you sick because they make more money.
And this was really galvanized, I think, you and many other people and these incredible turning point events during the campaign. It's not a slight on any one person. We all know good doctors. But as a simple statement of economic fact, because of the crony capitalism, because of the rigging of our CMS department and our FDA and our NIH, the standard of care if a kid has high cholesterol is a statin. The standard of care if they're a little bit sad is an SSRI. That's all because of the corruption in our agencies, the corporate capture. Doctors aren't talking to kids about healthy eating or functional medicine blood testing or getting outside. These things could be incentivized with our medical system. It's not a woo-woo thing. We spend $4.5 trillion on healthcare. And just as a simple fact, 95% of that is after we get sick. It's managing disease. Again, I mentioned they didn't say the word obesity, diabetes, heart disease. Those chronic conditions are 92% of deaths in America right now. They said the word measles 25 times, the Democrats. 300 Americans, just 300 Americans a year died of measles in 1962 before the vaccine was invented. It's a problem, right? But we're not focused on the main issue as a healthcare system. And that's the opportunity that Bill Cassidy frankly has with this vote. This is historic.